Hello, my name is Don Berg. Welcome to the final episode of this series on nurturing educational policy. Compulsory schooling policies in the United States today force schools to perform two core functions: academic enrichment and custodial care. I have no problem with schools having those as core functions, but district policies typically force teachers and children into the same room, then attempt to dictate their behavior. Even if teachers can achieve the status of benevolent classroom dictators, this is the wrong model of power to teach children living in a democratic society. I have more to say about that in videos on my teaching philosophy and the hidden curriculum. Worse yet, schools are being forced to kowtow to standards and testing regimes that pressure everyone to ignore the basic human needs of teachers and children in order to keep up with the instructional bookkeeping that is required to stave off dire punishments from state and federal authorities. What if hospitals and surgeons were regulated this way? If you go into the hospital for surgery, then you'll probably have to stay there for a while, and the hospital then has to serve the two core functions of providing surgical services and custodial care. If they were regulated like schools and teachers, then the surgeon's job would depend on making people get surgeries, and the hospitals would face reorganization or closure if their patients don't recover fast enough. Standards for recovery time would be normed, with the expectation that every patient will recover from their surgery within, say, 4 days by 2014. This would be a recipe for medical disaster, of course, because it would bias surgeons towards recommending surgeries as a matter of course, but then recommending the particular surgery that is most likely to enable a quick recovery, even if a different surgery might do a better job of solving the medical problem. This kind of policy would encourage hospitals to discharge patients without full consideration of their individual healing needs. Of course, most doctors and most hospitals would still do a basically good job, but the policies would create the conditions that would inevitably invite problems. In education, this kind of disaster is unfolding because high-stakes testing and universal standardization systematically distorts the judgments of school administrators and frontline teachers. Despite their best natural intentions to nurture the children in their care, their caring behaviors are slowly being replaced by bureaucratic behaviors that serve relentless systematic demands for instructional bookkeeping. This is wrong, and we can do better. Compulsory schooling as custodial care should be about guaranteeing every child access to a nurturing community environment that utilizes one of many variations on democratic power structures to implicitly teach the basic skills of citizenship. On the other hand, compulsory schooling as academic enrichment should be organized to ensure instructors can provide professional services to maximum effect and at optimal efficiency to children who are motivationally ready to meet the highest standards of behavior. We can do better by our teachers and children by making schools universally safe and welcoming communities that nurture children and where academic instruction flourishes as a sought-after enrichment experience. Nurturing children in schools is like antiseptic procedures in hospitals. It's not the core purpose, but it is absolutely necessary for the core services rendered to meet basic standards of professional integrity. My website is about creating educational policy that reflects basic standards of professional integrity. Promoting this agenda is necessary because some education professionals, and most of the policymakers who determine how educators are held accountable, do not seem to realize the proper role of nurturing in education, in the same way that doctors in the 1800s did not realize the role that antiseptic protocols could play in preventing infections. I think it is important to note that it was not a theory that led to better practices in medicine. It was better practices that led to better theories. Here's a quote from a University of Florida School of Medicine article about the earliest antiseptic protocol. Quote, Ignaz Semmelweis, a Hungarian physician from the 1800s who specialized in surgery and obstetrics gynecology, is known today as the savior of mothers. He is credited for finding in 1847 that the incidence of puerperal fever, which typically afflicted women who recently gave birth, could be drastically reduced by the use of hand-washing standards in obstetrical clinics, end quote. The routine of hand-washing as a standard medical procedure was discovered to be effective at preventing infections before the germ theory that would explain why it was effective was accepted. This practice before theory pattern may be true in education as well. Recent research, including my own, suggests that there are alternative schools that have similarly pioneered nurturing practices in the absence of a proper theory that explains the role of nurturing in education. All the research on patterns of motivation in mainstream schools for 30 years have shown declines in intrinsic motivation, which suggests a pervasive thwarting of basic psychological needs. Now, homeschooling and democratic education are alternative school practices that go back at least 50 to 100 years. A few small studies have collected data that suggest that students participating in those practices maintain their levels of intrinsic motivation, from which we can infer that these kinds of schooling systematically nurture those children. What encourages me to take such a small amount of data so seriously is first that the research in this line has shown causal links between nurturing as psychological need satisfaction and intrinsic motivation, and second, that the studies in regular schools anticipated these results would be possible. So, is it reasonable to expect schools to nurture children? No, it is unreasonable, in the sense that what motivates the need for nurturing is not a logical, reasoned argument. It is a moral commitment. Adults responsible for children must nurture them. That is simply a universal moral duty. The fact that the duty exists is not open to debate. On the other hand, it is reasonable to question how we accomplish that task and whether our programs and policies to do it are doing it well enough. There are important questions that we need to be logical about and have thoughtful discussions on. But expecting schools to nurture children is simply the moral foundation upon which a discourse about schools must be built. The lesson of history is that we have everything we need to make the necessary changes: long-established successful practices and a theoretical basis for empirically determining what's effective and why. The task at hand is to formulate school policies at every level, from the school building to the Federal Department of Education, that systematically root out and eliminate the barriers to nurturing while simultaneously providing systematic reinforcement of nurturing behaviors. Most of my site will be devoted to wrestling with the myriad of issues that arise from being an adult responsible for children in the roles of teacher, principal, district official, or state and federal policy maker. So, if you're committed to ensuring the well-being of everyone in our school system, then please educate yourself about how we can create an educational policy framework for making sure that children get the nurturing they deserve, and join in the discussion. Thanks for watching.